There's actually a pretty interesting story with how the comprehensive provider profile has helped the Centers for Medicare and Medicaid Services. Tom, I'll go to you first, but can you share how the CPP has helped CMS just protect vital programs to reduce fraud, waste, and abuse?
Yeah, so we have been supporting federal program now for over 3 years, providing both the criminal and over the last just about 2 years now with Verisys together to bring these two together to again drive more actionable insights for that federal program. And we see as again, this is across the United States, and there are over 6 million people in this program. So this has to be something that is good enough to handle just one state, but flexible enough to handle all 50 states. So, from a national screening perspective, we have gotten significant insights to jurisdictional trends, regional trends, and over the years. So Nicole was sharing about what happened in COVID. There was a huge change in activity from these individuals, post-COVID versus pre-COVID. Part of that is telehealth. Where are they providing this? But more importantly, were they then committing crimes as a result of that? And so we've seen a substantive change as a result of that. So the federal level has been significant for us to again support the prevention of fraud, waste, and abuse. But the second is the continuous learning on new trends of what providers are doing from the bad actor standpoint. Again, improving that model that so it can be the idea of this can be applied throughout all 50 states.
Amy, Nicole, do you have anything to add to that?
Yeah,
No.
I was gonna say what I like with this is that you take the CMS model, which has proven out very successful. In my mind, I sit there and think, okay, if there's a program that was so successful, where else can I replicate this? Can I replicate it? Because if you look at the CMS program, that's something that's federal, it's the Medicare level. Can this then be related and replicated down to a Medicaid level, down to a state level? If something is that successful, you can take that model, replicate it, and roll it out to like a Medicaid or a state level, or even across other organizations. So again, back to the payer space, the provider space, the pharmacy space. How can we help eliminate fraud, waste, and abuse with doing the ID verification, with doing the credentialing, with doing the background checks, with doing the monitoring?